Member for Elgin-Middlesex-London.
Thank you, Speaker. My question is to the Minister of Health. Minister, for the third time since 2006, your government has decreased the price of generic drugs. And history will show that a reduction in the prices is actually increasing the shortages and availability of drugs. For the first 11 years as a pharmacist, shortages were far and few between, but since 2006, shortages are a daily occurrence. Shortages such as warfarin, a blood thinner that keeps people alive, amitriptyline, an antidepressant, primidone for epilepsy, phenobarbital for epilepsy. Minister, what also occurs here is single-source drugs increase, and you only have to look as far as Sandoz as what occurs when there's too many single-source drugs on the market. When one little thing occurs, shortages drastically increase. Minister, do you consider the aspect of people having the availability to access the drugs they need, or do you just look at the bottom line?
Minister of Health.
Well, Speaker, I'm a bit surprised, I must confess, to have this question from a member who actually owns a number of pharmacies in his community. I do know, Speaker, that pharmacists were not happy with the changes we made to bring down the price of generic drugs. But I think that their warning, Speaker, that there would be closures of pharmacies, that people would not be able to access drugs, has actually not borne out to have happened, Speaker. In fact, we've got more pharmacies in Ontario than we had before we took on the price of generic drugs. The issue of shortages, Speaker, is an important one, and I can tell the member opposite that the best information I have indicates that there is absolutely no relationship between drug shortages and the changes we've made to generic drugs. And if he has information to the contrary, I'd be very interested in having them share that.
Supplementary.
Thank you, Speaker. Back to the Minister. Minister, I am proud to be a pharmacist and a healthcare professional. And my focus in life is the safety and the care of my patients. Minister, you've announced that 10 of the drugs will have reduction, yet you haven't taken into consideration announcing the list, how the list is going to be maintained, what happens when new drugs move onto the market that are going to be high volume and high cost. In fact, you've sprung this decision without consulting with the industry, without consulting with patients. Minister, can you tell your patients why you make such serious and drastic decisions without consulting with industry and the patients?
Minister of Health.
So, Speaker, you know, I'm actually very, very proud of the changes that we have made to the pricing of generic drugs. We have saved $600 million per year, Speaker, as a result of the drug reforms. You know, for a representative from a party who is saying that we're spending too much, but then cannot support us as we actually make those tough decisions to bring down the price of generic drugs, I'm just a bit confused, Speaker. You know, we have brought...
The Minister of the Environment will withdraw.
Withdraw. Oh, okay, withdraw, yes.
Excuse me. Stop the clock. He is right, but technically, quite frankly, there is an order that allows someone to bring clarity to that question. Minister of Health.
So, Speaker, as I say, I'm proud of the changes that we've made. I'm proud that we've been able to bring down the price of drugs, not just for government, Speaker, but for the public as well, Speaker. So these are important changes, and I will continue to drive the best value for the health care dollars, Speaker.
Thank you. Question, the member from Timmins James.